Kia ora tātou hui mai nei. Welcome to the Community Health Services Zoom meeting. I'm Linda Cooper and I'll be facilitating today. You haven't got the fabulous Hinimoa today, but I'm going to do my very best. I'm going to start with a karakia to get us going. Kia hora te marino, kia whakapapa po nāmu te moana, he huarahi ma tātou I te rangi nei, aroha atu, aroha mai, tātou ia tātou katoa, huie tai hiki. May peace be widespread, may the sea be like greenstone, a pathway for us all this day. Let us show respect for each other, for one another, bind us all together. So welcome everybody. It's a beautiful day for a community forum. We're still online. And I know at the last meeting we said we may be together physically, but we're still online today. And it's great because I think more of you are able to turn up, which is really good. So first of all, we will be recording the presentation to post online. And the presentations will be run in order of agenda. There's only one person from each organisation to present, because I notice there's a couple from each sometimes, which is great. Presentations will be timed and presenters will be muted at 1:30. And I think some of our admin people can get a bit, be very strong on that one. If everybody, you've probably all been well schooled on this, and it looks like most people have, but just put your name in your screen, which looks like most of you have, which is great, thank you. It just helps us if someone comes in a bit later and you're speaking, they know who's speaking, so they know where we're up to. Presenters can put your contact details in the chat bar, and Tracy will email those all out to everybody later. And that just means if people have got questions for you, because it's too hard to do that in this forum, you can just contact those people and ask them your question and connect up with them out in the community. And so first of all, I'm going to let you know who is coming to listen to you. So today we have some GP pharmacy staff attending. So we've got Swanson Medical Centre, Jason Gentiles, from ProCare, Head of Equity and Change Manager, Mihi Blair and Nivi Sharat-Chandran, welcome. We have hospital staff from Waitākere Hospital, our patient experience for volunteers, that's Genevieve Kaimbo Nokonko. I'm not sure if any of the hospital volunteers are here, but welcome to you. We're having the Waitākere Hospital GM will join us, Paula Seymour, at 10:30. I'll let you know when that happens. Patient Experience Director, Rovina Patel. Patient Experience, Erica Fairbank. Consumer Counsel, Jane Drum and Laurel George, welcome to you. Dietitian Clinical Lead, we have Amanda Whitford. Ops Manager, Asian Health Services, Grace Ryu. Clinical Lead Dietitians, Ashley Sher. And Simulation and Training Centre, Anne-Marie Marsh. And COVID Response, Linda Lazarus. So welcome to all of you wonderful hospital people. And then the community people attending, Liz Manley from the Waitakere Rangers Local Board, Sharon Davies, a community freelancer, and you'll see her popping up everywhere. Kay Lindley, Zari Fazalnia, all the way from Iran, and Sunil Kaushal are all on the Waitakere HealthLink Executive, and Colin Mitchell. And we've also today got Lance Norman, who will be speaking on behalf of Waipareta for an update, but also Lance is going to take us through information around locality planning for West Auckland, which I'm sure a lot of you are really keen to hear where we're up to on that. That's really important for the West, that we've got strong advocacy for services out West, and particularly our hospital. So that's really, really good. Thank you, Lance, for coming along. You've been really forthcoming. We've already set up a group, a West Auckland group of many organisations to feed into that, but he'll talk more about that. So I think, Tracy, it's time to start the presentations, isn't it? Have I missed anything? That's someone else?
No.
All right, so what we're going to do, yeah.
Someone who came in that wasn't RSVP'd is Karen Wills from Radiology. Welcome to you.
Great. Welcome, Karen. So what we're going to do, and I might be teaching, preaching to the converted because some of you have been here before, but if I read out the presenters, and as I read you up, put your virtual hand up, which you go to participants along the bottom, onto reactions along the bottom, the little smiley face, click on that, and then there'll be some emojis come up, but there's a sort of a grey bar that says raise hand. So if you raise your hand and then you kind of come to the top in that order, and then you get to be seen, you're highlighted on the screen, and then Tracy will lower your hand for you because it's very easy to forget that as we go along. So I'll start with Katie from Asthma New Zealand, if you can pop your hand up. Thank you, Katie. Nicola Brenton from Dementia Auckland. And we've got Trish Fleming and Stella McFarlane from Hospice West Auckland. And we have Life Unlimited Hearing Therapy, Kim Howell and Jackie Taylor. Then Muscular Dystrophy Northern, Lynn Williams. And Stroke Foundation, Monica Lewinsky. And those are all our long-term conditions. Tracy, shall I?
I've just got one thing. We've just
Yep.
got Parkinson's joined. So can you add Parkinson's at the bottom of the long-term conditions? Just email me.
Who's that?
Rachel Turner.
Rachel. So Rachel, if you can put your hand up.
Not in yet, but she will be by the time.
She will be. All right. So, and I'll go through the same process when we get to the next category. So we read at a time. So we've got Katie Faiasa from Asthma New Zealand. Welcome. 1.5 minutes.
Morning, everybody. Thank you for having me. So Asthma New Zealand is a not-for-profit charity organisation. So we've got basically our main goal is education through face-to-face visits and virtual. We see people across all of New Zealand, and we know that education is a powerful tool in reducing hospitalisation and supporting our mission to see a 50% reduction in asthma and COPD hospitalisation by 2029. So we get referrals from everywhere. Please refer to us, any patients or people, whānau, that you may think benefit from our services. We've got our website, www.asthma.govt.nz. Please come and visit us and give us a referral. We'd love to sort of see anyone that would like to. So we offer free education. We demonstrate the use of inhalers. We deliver education to high school students and teachers. We do school visits. We deliver asthma and COPD education to health professionals throughout the year. And we advocate for our patients, and we also sell stock, so nebulizers, dust mite protectors, allergy products, that sort of thing. So that website again is www.asthma.org.nz. Thank you.
Kia ora, Katie, and if you can just pop that in the chat bar, that would be really wonderful. So next we have, and if you can just lower Katie's hand. And so now we have Nicola Brenton from Dementia Auckland. Welcome. You just need to unmute yourself, Nicola.
Kia ora, everybody. Welcome. Lovely to see you all. I'm the dementia key worker and I cover the West Auckland area. We are a support service that provides information, education and support to families who are living with a person with dementia. We've got groups for people with dementia. We've got an art group, a music group, a walking group. We run cognitive stimulation therapy. We've got support groups for caregivers, which meet monthly. We have masterclasses that we offer to families as well as health professionals. We also have a carer education program that runs online and face-to-face. I accept referrals from all the usual sources, including self-referrals, families themselves. I'm available to home visit and meet with families to talk about strategies best ways of interacting and building resilience in families. So that's it from me. Welcome all referrals. Thank you.
Oh, kia ora, Nicola. It's great to hear you're out there doing that. Now, Mark Allen has just arrived from he's CEO of Community Waitakere and a colleague of Liz Manley on the Waitakere Rangers local board. Welcome, Mark. So our next speakers are from Hospice West Auckland, Trish Fleming and Stella McFarlane. Welcome, ladies.
Kia ora tātou katoa. It's lovely to see everybody and to connect on Zoom. Hospice West Auckland cares for anybody aged over 18 with a non-curative illness with complex symptom management needs in the Te Whare Tapa Whā perspective. We care for people from the Kaipara down to the Whau River, right out through the ranges and into Greater and Central Auckland over to Te Atatu, where our hospice house is located. Reopening and have opened all of our community day programs at Hospice House. If you'd like to know anything about those or to visit us, you are very welcome. So as I said, we care for anybody aged over 18 with any illness. Often people think we just look after people with cancer. We're a full interdisciplinary team service providing spiritual care, counselling, medicine, pharmacy, aromatherapy, art therapy, music therapy, nursing, social work. So we really aim to care for the people people who are dying and their whānau from a full Te Whare Tapa Whā perspective. So it's business as usual for us. We have a full virtual team service as well, and we are a 24/7 service. So our families are able to phone in after hours to get the support that they need in the middle of the night when things might not be going according to plan. Oh yeah, we have rongoa therapy, rongoa Māori therapy. Gosh, I always feel I missed something. Physiotherapy,
You said yourself, Trish.
Well, looks like you might have been muted, Trish, but wonderful information. And also, I think what's not known as Hospice West Auckland are probably only 24-hour hospice service in the country, leading the way out west. So next we have Life Unlimited Hearing Therapy, Kim Howell and Jackie Taylor. Welcome.
Hi, it's Kim Howell speaking. I'm sorry, I can't find my hand. Can you still hear me okay?
Yes, we can hear you really well and see you.
Hi. I work for Life Unlimited Hearing Therapy. We are a free independent service for all New Zealand citizens and permanent residents aged 16 years and over. We offer assessments that can include a hearing evaluation, information on hearing aids and other technology, and including available funding that may be applicable to that person. We offer practical help and advice and tips for living with hearing conditions like tinnitus, and strategies for you, your family and your whānau. We welcome friends and whānau to come along to support the person that we are seeing. So please do, everyone is very welcome to come to our clinics. We have a number all over Auckland. Okay.
Thank you. And just to remind people, if you want to put your details in the chat bar, good. We've just got some from Nicola, and that's really helpful. And they'll be collated at the end and sent out to everybody. So next we have Lynn Williams from Muscular Dystrophy Northern. Welcome, Lynn.
Good morning, kia ora everybody. My name, as Linda said, is Lynn Williams from Muscular Dystrophy, previously Epilepsy New Zealand. I've only been in this role for 6 weeks now, so my job encompasses field work, meeting with clients, talking to Taikora Trust and people like that on their behalf, attending clinics, supporting them, giving them information, and generally just trying to ease them into a life pattern from diagnosis to how they're going to be affected. I have some really, really great people I work with who know everything about it. We get the referrals come obviously from Starship Hospital or from Auckland Hospital, excuse me, but happy to help anybody you may know of who might have this condition. And yeah, just being supportive and hand-holding in a lot of cases. And that's me. Thank you.
Oh, thank you. That's great to hear the support out there. So next is Monica Lewinsky from the Stroke Foundation. Welcome, Monica.
Kia ora. Yes, so I'm from the Stroke Foundation, one of our community stroke advisors, and I cover the Upper Harbour area. At the Stroke Foundation, our mission is to prevent stroke, improve outcomes, and save lives. And our community stroke advisors work with people affected by stroke, their whānau and carers, to achieve the best possible outcomes for their lives after stroke. We do that by providing support, information, and advice to build knowledge and skills and connect people affected by stroke, their whānau and carers to the services they need to aid their recovery. We also have a return to work service that liaises with employers in order to create a return to work plan that works for both the stroke survivor and the employer. And we also offer free blood pressure checks with our van, which visits various locations throughout Auckland, raising public awareness of the risk of stroke by offering the free blood pressure checks and education on maintaining a healthy blood pressure. Thank you.
Thank you, kia ora. And the last presenter for long-term conditions is Rachel Turner from Parkinson Foundation.
Hi, I'm Rachel. I'm the West Auckland and Rodney Community Educator Nurse for Parkinson's. We provide one-on-one support to people with Parkinson's and their families and Parkinson plus conditions, of which there's about 11 now. I also run support groups. We do all their community referrals to the hospital for things like physio, OT and all that. I work quite closely with hospice on some of the plus conditions and open to new referrals. Most of our services are back up and running now. We're just doing a little bit more via Zoom and telehealth.
Right, thank you. Kia ora. And I think that's the end of the long-term conditions. And I guess the purpose of this forum is for our health professionals, both in the hospital and primary health care. It gives you all an opportunity to connect your patients with some community support. And that's a really important part of the total picture when people have these conditions and things happen in their lives. It can't all be done in the hospital. It's a real team effort. So I hope that's going to be helpful to you when you're thinking about what your patients need while they're out living in the community, the fullest life they can. Thank you. So we're going on to mental health and social services. So I'm just going to do the thing where we put your virtual hand up and I'll read it out in order, and then you'll come up to the top of the screen in order, which is great. So we've got Cancer Society, Fiona Sayer, Care Waitakere, Katrin Wolfart and Maxine Finley, the Grief Centre, Larissa Lovell, Family Action, Michelle Clayton, also Waitakere Rangers local board member, Health West, Araha Hudson, Man Alive, Jonathan Corker, and Rob Warrener from Walsh Trust. So we'll get going. Oh, is everybody okay there? Is there? I just ask if you're not speaking, just mute your microphone, because sometimes that can get left out and you might be having a phone call and we can all hear it. Thank you. So Cancer Society, Fiona, welcome.
Kia ora, whānau. Ko Fiona Sayer, taka ingoa. I've just done a PowerPoint, if that's all right.
Sure.
Just to let you know what we do. So I'm based out here in Northwest, and so we actually cover all of the area, Auckland, Northland, counties, Manukau, Waitemata, Auckland and Northland DHB. So part of the community liaison nursing services, we do assessment and supports in the home, as well as dealing with the symptom and side effect management, and we also provide information to whānau. And we often are navigators, and we liaise and refer on So these are some of the nurses that are out here. So we've got Frances, who'll be up here from December. Jan Stansfield covers Henderson. Sandra Wood has got part of Te Atatu, and Deb Smith is North Shore. So there's probably some names there that you may be familiar with. So we, as I said, offer the support to whānau and patients with a diagnosis of cancer, whether they're receiving treatment for cancer, and again, doing the chemo orientation. The Cancer Society also does have psychological services, and they offer group programs, some relaxation, stress management, yoga, and as well as that, there are webinars online. We do have a volunteer service that facilitate the driving of people to radiotherapy appointments, and that's assessed on a case-by-case basis. There's criteria that they need to meet to be able to be part of that. How to refer to us? You can ring the 0800 Cancer. There's the website for the online referrals, or you can email the electronic referral to support services. Online, you'll see there whether it's an Auckland, Northland referral for health professionals, patients can self-refer, and there is the form that we have, quite self-explanatory. If you don't
Right. Thank you very much, Fiona. Probably you've got a bit of a quick finish there, but you did really well. I think all of it's there. It's great. So next we have, and actually I just put a note in the sidebar. Michelle Clayton from Family Action is not here, so whoever's here from Family Action, if you can just pop it in the sidebar for me and pop your hand up. So Kia Waitakere, Katrin and Maxine, welcome.
Kia ora. I'm Katrin from Kia Waitakere. I'm a social worker, and with me is Maxine. She's our operations manager. So Kia Waitakere is a community-based NGO. We're based out in Te Atatu Peninsula, and we will open our second site in Henderson next April. So you can also find us there soon. We offer really a wide range. We offer our primary service, which is counseling. We have budget advisors in our house. We offer social work and family support and food assistance to provide our clients with food parcels that need a little extra help in that case. So our counseling, we provide either free or low cost, depending on the funding. So it's very accessible. It goes from children through to adults and also includes ACC funded counseling. Our budget advisors offer setting up basic budgets, benefit check, advocacy, etc., etc. And the social work and family support also offers a wide range of supports. So the team is made up by my colleague and I, and the support we provide is not bound to any criteria. So we tend to rather have short-term interventions rather than long-term, but that's also not a criteria. We offer family harm support, parenting support.
Thank you, Katrin. You got the mute button there, but thank you. That's very fulsome. So next is Larissa Lovell from the Grief Centre. Welcome, Larissa.
Kia ora tātou. My name is Larissa and I'm from the Grief Centre. The Grief Centre is based in Te Raki Powhenua on the North Shore, but we have contracted counsellors and clinicians that work in Henderson and Remuera. So we essentially are a counselling service just like Care, but we also provide professional training and development for anyone that's in a care and support role, which is why I'm taking this time to speak with you all now. So other than just providing that training, we're really looking for new speakers. And I know that you are all experts and really well skilled in your fields and the areas that you work in. We need some more presenters. We've got a really massive schedule that's happening in 2023. We want to know if anybody or anyone here in the Waitākere Health Link whānau want to talk about what you do. keeping in mind that the audience are other professionals, anybody from a volunteer right up to a clinician. So I'll leave my details in the chat box, my email. If you feel like what you do and the mahi that you do now would be helpful for anybody out there that wants to learn about it, just send me an email and we can talk about it. Kia ora.
Oh, kia ora. That's great. So have I got anybody from Family Action? No response. So seeing I'm the chair of Family Action, I'll just take my 1.5 minutes timing from now. So Family Action runs the West Auckland Women's Refuge for victims seeking safety from family violence. We provide refuge for victims who are urgently seeking safety. Each case is assessed and a safety plan created with the person. Sexual harm crisis. Family Action specialises in providing free and confidential support in West Auckland for survivors of sexual harm and their family whānau. Our crisis team is here to help. It's a 24-hour service, whether it happened recently or in the past. Family Action Outreach supports all people in crisis who are experiencing family violence. Family Action provides a caring and confidential place where you can talk about issues in your relationship, no appointment needed. And we are based down in Edsall Street in Henderson. Thank you. So that's me, all Family Action. Right, Health West, Kia ora Araha, are you here?
I haven't seen her come in.
3-second rule, 1, 2, 3. So we'll go to Jonathan Corker from Man Alive. Welcome, Jonathan.
Thank you. Morning, everybody. So my name is Jonathan from Man Alive. I work in the youth department here in Henderson. We're a counselling service and specifically for boys and men. But I'm just going to give you a quick overview of the youth department here. We work with clients from an age range of 8 years old through to 24 years of age. And we have 4 distinct programs. The first one is Boys Alive, which is dealing with anger management in a group setting. And that's during the school term, every 8 weeks of every school term from 4 o'clock through to 6:30. We also work with the whānau of the boys that are part of the group, up to 12 boys. Secondly, we have another program called Growing Men, which is anger management again, but on an individual basis, usually 10 to 12 sessions. We have youth general counselling, which is any challenges ranging, depression, anxiety, bullying, drugs, alcohol, sexual abuse, parent separation, or sexual identity, any challenges in those fields. And lastly, Boys Alive within schools is a transitional program for years 8 moving into year 9. So from intermediate into high school. So thank you for your time. I'll put the information in the box and have a good day, everyone.
Good, Jonathan. So we're on to the last group in the mental health social services, Welsh Trust. Rob Warrener. Welcome, Rob.
Thank you, Linda. Nā mihi nui kia koutou katoa. Welsh Trust provides a range of mental health services across West Auckland. These are delivered by around about 85 full-time staff and 20 to 25 part-time staff. Principally, they are home-based mobile services that provide supports to people in the communities at home or anywhere else people prefer to meet. We also have a number of contracts that we work closely alongside GPs, so there's not quite a straightforward introduction process there rather than any kind of complicated referrals needed from the DHB. Other services that we're particularly proud of are maternal respite and home-based services to assist new mums and their babies at home. We're growing our peer support service, increasing the number of people we employ with their own lived experience of mental illness, who provide quite a unique means of support for people. Older persons, respite service, and an employment service. And I guess our current priority at the moment is, I guess, responding to the challenges and opportunities that come through to Whatu Ora. Thank you, everyone.
Yeah, thank you, Rob. Great to hear from all of you. So the next section is maternity and child health. So have we got Gomita here from Parent Aid and pregnancy help? I saw pregnancy help come on. So I don't see Gomita. How about Laura and Julia from Pregnancy Help? Are you here? Just pop your hand up, your virtual hand.
I think, is it PH help?
PH Help.
Yeah.
PH.
Yeah. I don't know, just a little logo there. I'll ask them.
Speak up. Oh, can you put your hand up on the, go to the reactions button on the bottom of the screen, click on that, and then there's a raise hand, and click the raise hand, and that brings you to the top of the screen. So thank you. So that's is that Laura or Julia?
Laura, yeah. Is it my turn now?
Yes, it is. 1.5 minutes. Welcome.
Okay, hi, I'm Laura. I'm the coordinator of Pregnancy Help in Auckland. We have an office here in Parnell, Stanley Street, Parnell. Our mission is to help vulnerable mothers, to assist them with any help they need during their pregnancy and when they're having the babies. We provide free clothing, all pre-loved but well selected. And we also loan up bassinet for 4 months. And we will give out other items as and when we have them in stock. And we have 2 outreach centers, one in Otara to service people who thinks it's too far for them to come to the city to collect those baby items. But it's only once a week, every Tuesday, run by a volunteer. And we also have an outreach center in Blockhouse Bay, also once a week, every Wednesday by appointment, because all these centers are run by volunteers and by appointment. And at the moment, we have got PAMS nappies have given us a whole lot of nappies that we are happy to give out to any moms who contact us. We still have got some nappies here, so any one of you who knows of any families who needs disposable nappies, we have PAMS nappies that we can help them until stock lasts. Okay, and our office here in Parnell is from Monday to Friday, from 9 to 3:30, Monday to Friday, and we are manned every day with a staff, at least a staff here. Okay.
Thank you very much. It's great. Now I just want to, that's the end of that section, but I just want to acknowledge we've got Karen Wills from radiology, and we have Anne Davis from Health New Lynn as our health professionals here today. So the next section is community health, and I'm just going to just beg your indulgence that we put Tani, the Asian Network, first, because Samuel needs to leave shortly, and I want to make sure he can do this and not miss his next meeting. So we'll go and put the hands up, will be the Asian Network. So Samuel, then if you pop your hand up, then we've got Ashvini Chandra from Asha Services, then Citizens Advice Bureau, Liami Wade, Real World Living, Robin Hoffman, Ranawi Action Project, Arafita Smith, Sport Waitākere, Kerry Allen, St John, New Zealand, Eleni Mason, and Lance, you can put your hand up there from Te Whānau Waipareta, and the Well Foundation, and Renee. And we'll get started, and we'll start with Samuel. Welcome, Samuel. And Samuel's also on our WHL executive and also on the Consumer Council. Several hats.
Thank you, Linda, for putting me in the front. Kia ora koutou, everyone. I'm Samuel, working at Asian Network as a manager. We are committed to the promoting health promotion and capacity building for particular Asian community and migrant and refugees. So, which means just we promote health messages for them to prevent and manage their health condition. As also we provide education so that they can need to know about the local information, oral health information, and also systems. So we also facilitate the capacity building program in different range to cover their needs for particular those population groups. So if you are looking at your Asian client needs some kind of more support, and then connect to the other specialists, and then just let me know. Probably I can help you to get your client to connect with those kind of healthcare professional or social workers. We provide the regional network meeting where we foster your collaborate opportunity in the future, and more connect with the other people working in the sector of the health and social work as Asian professional. So if you come to that, you're welcome, which is planned to be held next Wednesday, 23rd November at the Western Springs Hall, Garden Community Hall, started from 10 a.m. to 12 p.m.
Oh, you've been muted, Samuel, because you've gone over your time. That is the consequences. But thank you, Samuel. You've got a lot of information in there. There's just a question in the chat bar. Will hospital organisations, departments have a presentation time? I think we've got a quick time at the end of this part to just a quick hello, a quick elevator pitch. Hi, I'm such and such, and I do this would be fine, because we're doing quite well on time. So next we've got Ashvini from Asha Services.
Morena, everyone. Morena. So my name is Ashvini and I'm from Asha Services. So I'm a health promoter. And so Asha Services basically provides free counseling services nationwide for the South Asian community who are impacted by gambling harm, regardless of their resident status. Alongside our counseling, we also do a lot of public health work just to go out in the community to educate and raise awareness about about gambling harm, and also do a lot of community screening. We are also part of COVID response team, which means is that we provide culturally appropriate food and financial support for any families or individuals that are affected by COVID hardship. Our support is available through face-to-face, Zoom, over the phone. Our counselors speak Hindi, Fiji Hindi, and English, and we are open from 8:30 to 5 p.m. Monday to Friday. Thank you.
Thank you. So we now have Citizens Advice Bureau, Leomi. And I hope I've said that right, because that's a really unusual name. I wanted to say Leone, but I was corrected that it is Leomi. Welcome.
It is Leomi. Hi, thank you.
And you've got Kim on your name here, but we'll definitely know you're Leomi. Welcome.
Yeah, I will fix that. I'm an incoming manager, so I'm really just trying to learn as much as possible about all of the different services that we can send people to. We're really trying to emphasize getting local things for local people. Our Glen Eden has obviously got some serious issues going on, so I'm really just trying to make sure that I'm aware of everything that everyone's doing. This is a really good fact catcher for me. But if you do have clients and you feel like you're helping them to the best of your ability in some areas, but maybe they need more help in other areas and you don't know where to go, please always send them through to us, because we are really help people to guide them to what they need. But obviously that's why I'm here, so that all of you can tell me all the fabulous things that you're doing. Yeah, thank you very much for having me.
That's great, and CAB do a great job. I've just been doing a bit of JP work there lately, filling in for someone with a broken leg. So they do a great job. So next we have, oops, a piece of paper, Real World Living, Robin.
Yeah.
Welcome,
Good morning.
Robin.
Good morning, everybody. I'm Robin. I work for Real World Living. We are a disability provider for people over the age of 16, and we are based in Papakura and Penrose, but we have clients that come from as far as Te Ratu out that west, all the way to Bombay, so everything in between. We also have a transition service which operates across Auckland for people leaving school that are either AUS funded or aren't AUS funded, so we can offer services so they have a direction of what they're doing when they leave school. My role is networking and communications, so my role is actually in the community 95% of the time, and seeing what is available, what is out there. A really cool thing that we've got going at the moment is we're making little libraries for communities, so they're like postbox libraries. We've got 9 in the community at the moment and another 17 on order. There's no fee for this, they're free. Everything is provided for you. It comes so you can decorate it. So if anyone's interested in any of those, you're more than welcome to contact me. I think that might be my time. Thank you.
Right. Thank you, Robin. Thanks for doing some work out west for us. So next is Rānui Action Project. Arawhita, are you here? Might do the 3-second rule and move on to the next person. And if you want to come in, just type me a message in the sidebar. So Kerry Allen, the famous Kerry Allen from Sport Waitakere. Welcome, Kerry.
I haven't seen her either.
Oh, okay. So next is St John, New Zealand, Eleni Mason. Yes, Eleni's here.
Talofa, hi. St. John is better known for its front ambulance services. I want to highlight some, but not all of the services we provide for the community. So there's 3 Steps for Life is a basic training that covers the following: calling 111, starting CPR, and using an AED. This is free to organized groups from 10 people upwards. The second one I want to highlight today is Health Shuttle. This helps people with health or mobility challenges get to their well-being appointments. It supports DHBs to achieve higher appointment attendance, and bookings must be made in advance. Drivers and support people are all volunteers. This is Koha based. It's no set fee, but users encouraged to make a donation. The third one I want to highlight is Supporter Scheme, which is an ambulance membership per annum. It's $55 for an individual, $75 for 2 people, $90 for the household. The cost of one emergency ambulance is $98. We're working side by side and across multicultural community groups and providers to see where we can add value for better health and well-being outcomes for the communities we all serve. I shall put the rest of the services we provide in the communities in the chat, in case you cut me off.
Thank you, Lenny, for Tailama.
Right.
And just for Tim from the Well Foundation, I can't seem to respond to the sidebar. So yes, all good. Tim's going to replace Anne. So, Tawhana Waipareira, Lance, kia ora.
Oh, kia ora whānau. First, I'd just like to acknowledge the passing of Mason Nafika last week. Moi rā i te rangatira. So, whānau Waipareira, based in West Auckland, Henderson, next to West City with the green big tohu on the building. We do social services, educational services, health services, sort of lead out the whānau kaupapa out West Auckland way. Some of the big things we're working on at the moment, we've just been accredited from Oranga Tamariki as a 396, which gives us the ability to manage Oranga Tamariki houses and work with our whānau on a more appropriate measure. Unfortunately, we're working with a lot of whānau around ram raids. A lot of those young kids have come from West Auckland, and a lot of them are Māori. We're rolling out our community-based primary care strategy, which will see containers placed around our communities. But the big thing is localities that we're working on, and that'll be a separate presentation that we do later on in this piece to protect sort of Henderson-Massey, Whau, and that kaupapa. So I'll put our details in the chat, but if you can't find us, it'll be the big growing tohu in the sky in the evening. Kia ora.
Ka pai, kia ora. So, Lance, so the last presentation from NGOs is from the Whau Foundation, and Tim, the director, is replacing Anne Rennie. Now, Tim, you had a few slides that you thought might be of real interest. So our controllers in the back room, if we just give a little bit of leeway on this, given it's the last one. Thank you,
Well,
Tim. Over to you.
Are you telling me not to mute Tim?
Yes.
Thanks, Linda.
And I'm not playing
I'm not asking
favourites.
for
It's just he's
preferential
got
treatment. I guess
pictures. He's got pictures.
I guess I segue into the, I guess, updates from the hospital end, and the Whau Foundation are the official charity partner of
Sorry, Tim, you're getting a bit of feedback. Is there some way we can, maybe I'll unmute, see.
Is that any better? No? Great. Yeah, so we're the official charity partner of health services across the region in the hospitals. So we're quite close to a lot of the future developments, the innovations that are happening, and we bring together funding from the community to help make this happen when they wouldn't happen otherwise. So just wanted to update on our project level, really, the things that the community happening that I'm sure you'll be interested in. So I've updated in this forum before about the primary birthing unit at Waitākere Hospital. So this is meeting the need that the only non-hospital birthing options for our community are in Helensville and Woodworth, and so them being so far away from a tertiary hospital means that they're not taken up to the extent that we would want. So we're trying to build a 6-suite.
Tim, I'm sorry, Tim, your sound is pretty bad. Sorry, I don't know whether is there something you can do, because it's really important information.
Excuse me while I relocate.
You shouldn't be doing it in a bathroom. It echoes.
Any better?
Yes, I think so. It's just breaking up. All right.
Sorry. So
Much better.
Great. So the model there is that because there isn't $12 million capital available to build that facility, but yet it has been endorsed as a priority by the whole region. The model there is that Whau Foundation secures funding for this through social investors. We build it on Waitakere Hospital site with a lease, and then we lease it back to, of the land, sorry, then we lease it back to the health service to deliver the maternity services. So that project has been fully designed. If we get approvals, it would start the build as soon as March next year, and it would be possibly completed within that 12 months. So it's a really exciting project. It's late stage development. The challenge has been approval. So it's now sitting with Te Whatu Ora, the new national governance and management group for the health service. It's actually also with Treasury and the Ministry of Health, because it needs approval there. We're anticipating that we'll know where that sits by the end of this calendar year, hopefully with an approval to build in March next year. So that's an exciting development for maternity services. And then the images I just wanted to share with you, and I appreciate that there is some reticence against significant infrastructure happening at North Shore Hospital that benefits West Auckland communities, but it is a reality, and there are some exciting things happening there that are going to provide care for our region into the future. And I just wanted to very quickly just share these images with you in case you're not aware of it. Many of you will. Can you see that okay? Yep. So this is called Tōtara Haumuru. It's the new hospital facility being built at North Shore, 150 beds across 5 wards, 8 new operating theatres, endoscopy suites, and it's a $400 million facility that is centrally funded by government to serve the whole region, including West Auckland patients. This is the North Shore Hospital site. It's located here where the old maternity buildings used to be located. So it's directly opposite Smales Farm. We're involved with trying to bring this Da Vinci surgical robot to the hospital, so that one of the theatres will have this minimally invasive surgical approach that's currently only available in private healthcare. Costs $4.5 million. We're bringing $2 million to the table to make it possible, which will create all sorts of opportunities for improved surgical outcomes for our community. We are also involved with turning the central courtyard area of the hospital, being beautifully designed with this glass-roofed atrium, and turning it into a healing garden like this. It'll be the first healing garden space within a public hospital in New Zealand. We're again trying to raise $2 million to do that. which will change the atmosphere of the hospital. And then lastly, there are these whānau rooms within the hospital, 5 of these spaces, and it's for patients that become either critically unwell or require end-of-life care. And it brings this coming together of clinical care with the ability for whānau to stay overnight in these amazing spaces. So we're raising the funds for that as well. So I just wanted to update you on that. Completion is scheduled for April next year, 2024. And so if you're ever driving past North Shore Hospital, it's already looks like a building with cladding on. The roof's going to be on by Christmas, and then it's going to be fit out for 12 months after that.
Thank you, Tim. It's great for us to get an update. Appreciate that. And thank you for everybody bearing with Tim having a bit extra time. What I want to do is we're running a bit ahead. So I think it's a good opportunity to let our primary healthcare and hospital staff attending, if they want to, say a quick hello. So I'll do the same process. So if I call out your name, you pop your hand up, then you come to the top. So Swanson Medical Centre. Yes. ProCare, Mihi and Nevi. Now, Nevi, I think you were coming in by phone, but if Mihi can put hand up. Not there. So hospital staff. So Genevieve, any hospital volunteers? Has Paula arrived? Yes, great, Paula, welcome. Patient Experience Director Ravina and Erica. Liz Manley, you're replacing Jane Drum, I imagine. Laurel, George. Dietitian Amanda, Ops Manager Asian Health Services Grace, Clinical Lead Dietitians Ashley, Simulation and Training Centre Anne-Marie, COVID Response Linda, and then Ops Manager for Waitakere ED Lee Wharero. So we'll just start with the first person, which is first person with a hand up was Jason. Welcome.
Hello, good morning. Hi, I'm just introducing myself. I'm Jason. I'm from Swanson Medical Center, and I've actually worked with some of those teams who introduced earlier, and it's nice to know, and it's nice to meet the other teams as well who's working with the community. Nice to meet you all. Thank you.
Thank you. And I hope people have got value listening. So have we got Mihi there or Nivi? Nivi, if you're just on the phone, just speak up because you're having technical difficulties. 3-second roll, 1, 2, 3. So we'll go to Genevieve. Not here. Any hospital volunteers? Paula. Actually, Paula, say hello, but you've got a bit of an update anyway in our updates after this, but I'm happy for you to say hello now.
Would you like me to give my update now?
Yeah, we could do. Yes, let's do that. It'll slice the time off at the other end.
Yeah.
Welcome.
Kia ora koutou.
Paul is the GM of Waitakere Hospital.
Yeah, kia ora koutou. As Andrea said, I'm the GM of Waitakere Hospital and Child, Women and Family Services. So it's lovely to see you all here. We do one day hope to have you back on site, which hopefully will be imminent. The update I had was really around the foyer refurbishment, which has been an ongoing project for a while, and we're just waiting for some final designs for that area, some more detail than we've had before. So we will be looking to see how we can use that space most effectively and having some NGO space in that area as well. So that will be coming up, and I'm just waiting for the project manager to give me some more information on that. We're also planning a refresh of the signage in the hospital because it is quite hard to get around. So just looking at how we can redistribute funding so we can continue with that. But hopefully in the new year, we'll see some really nice changes around the place. That's it from me. Thank you.
Thank you, Paula. It's always great. I think we all have a real heart for our hospital, And to hear good things happening like this just makes us feel all like we matter out west. So thank you. Now I think we've got Erica there from Patient Experience.
Good morning, everybody. I'm Erica Fairbank from Patient Experience. I work, well, my previous work was with the NGO as well as nursing. So I'm really hoping to put some bridges between the beautiful work you guys are doing for the patients and supporting staff. Thank you.
Thank you. So then we have Consumer Council, Liz Manley and Laurel, if one of you want to say hello.
I can do that. If Laurel is here, I'm happy for both of us to do that.
Thanks, Liz.
Kia ora tātou. Thank you so much, Linda. It's a pleasure to be here. I've taken over from Jane Drum, who some of you may know as the co-chair of Te Toko Tūmai Auckland Consumer Experiences Council. Jane has taken on a regional representative role, which we're thrilled about because she is a mighty force for consumers. So we are, I guess our vision is to achieve more equitable health outcomes through championing consumer and whānau voice. So we've been doing a lot of work around, currently one of the projects that we're involved in on a project-based level is the Te Toko Tūmai Auckland Hospital is changing their booking and scheduling and administrative platform. The project is called Tupunu Aroha, and consumer voice is playing an integral part of the design. So it's a real co-design project, which is fabulous for us to be a part of. And we're really seeing the impact of consumer voice in the design of the new platform. We have also been considering the national feedback and complaints system that is being proposed. So we're looking to do a regional submission to provide, again, to provide consumer input into that. And our bottom line is that it should be principle-based. So it should be based around principles of it being money enhancing, it being having a closed loop system so that when feedback is given by consumers into the health system, it's acted upon and consumers or their whānau are aware of what's happened. We also we acknowledge the workload and stress that our clinical staff are under. So yeah, just very mindful of the amazing work that the amazing mahi that is being done on a clinical side, but also by all of you. So thank you for the opportunity. Kia ora.
That's great. And also if Karen Wills from Radiology and Anne Davis from Health New Zealand can pop your hand up. So next is Amanda from Dietary. We got you there? No. So Grace, I see, or is it Ivy? Are you in there for Grace?
Kia ora, everyone. My name is Ivy. Apology, Grace is have another meeting, so I will be attend this meeting instead of her. And then my name is Ivy. I'm the team leader of Ancient Health Services, and then our service, we do provide a secondary support as inpatient and whānau, but we do also have a community support for our Asian Health Line, which is nationwide response phone hotline. And then our Asian Health Line number is really easy to remember, 0800 8830, and then we will provide the GP booking, breast screening group support, and also COVID-19 support. And also we do provide the health and disability health systems information. If anyone want to know more, and feel free to phone our Asian Health Line 0800 number 888830. And then we also have our ethnic bureau, and we also support the MERA group. So feel free, if you want to know more information, feel free to give us a call.
Thank you very much. Sheshe. Now we've got, I think the next hand looks like it's Lee Wharero from ED. Kia ora, Lee.
Kia ora mai tātou, ko le wharerau hau, Pataki whakahaere, moro te wahanga ohorere o Waitākere. I'm the Ops Manager here at Waitakere Hospital, emergency. I think we're all pretty familiar with what the emergency department does do. However, what you might not be aware of is that we've partnered recently with our on-site GP service, where we are referring patients that shouldn't be in ED, that should really be treated in a primary care setting, where they're not waiting. So this is a very big equity project for us, where we are reducing their wait times and having them seen within 15 to 20 minutes. So it's a big project for us, and it's been very successful in our after hours. Kia ora.
Kia ora. And I just want to acknowledge my husband went on the heart path in ED a few weeks ago, and he just went straight through. Great service. Thank you so much. Yeah, now we've got Anne Davis from Health New Lynn. Welcome, Anne.
Yeah, hi, sorry, my video's not working. Just the nurse manager at Health New Lynn. It's just great to hear all the different services and keep up to date with what's going on within Waitakere and providing a service and using all those services. So good.
Thank you. I'm glad you're all finding it worthwhile, because it's quite hard to get away from your work. But actually doing it on Zoom makes it a bit easier. So I'm just wondering, sorry? Yeah, it does. So thank you. So there was Ashley and Linda Lazarus, but also Karen Wills. Are any of you still here and want to say hello? 3-second rule. So we will now pass over to our coordinator, Tracy McIntyre, for the updates. And just noting, we've already had the foyer refurbishment from Paula.
Yep, so just put our updates up there. The video library, so if we're still trying to furnish our video library on our website, so if you want to use your 1 minute 30 presentation from today to upload to that, just let me know. We're looking for a youth voice on our executive. If anyone has any well-networked youths or work in that area, and you've done the foyer refurbishment and update with Paula about the hospital foyer. So yeah, back to you, Linda.
Thank you, Tracy. So just about right. No, we're 4 minutes ahead of time. Doing well. So now I'd like to welcome back Lance Norman from Te Whānau Waipareira, and he's also kind of with another hat, slightly related, to talk about the locality planning that now is underway. Now we're under Te Whatu Ora, a nationwide health service, I guess, and he's going to update us on what's in it for the West. Thank you, Lance.
Oh, kia ora whānau. I'll just bring up a presentation I've got. I've got a bit of a croaky voice because I was, like the rest of New Zealand, screaming at the rugby game on Saturday, but hopefully we'll get through this. So yeah, just in case people don't know who I am, so my current roles, I am the Director of Whānau Waipareira for Health Reforms. I'm also the Director of the Whānau Ora Commissioning Agency for Health Reforms that has about 100 Māori providers across the North Island. I'm project lead on a large-scale development we're doing between Middlemore and King's College out in South Auckland. And we're also establishing a Māori Public Health Commissioning Agency. And I've got the fortunate to be heavily involved in the iwi Māori Partnership Boards, particularly around locality. So we'll get into this presentation. So I'm just going to kind of go through the Paiora legislation and then relate it to the mahi around localities. If you haven't seen this legislation, it's probably compulsory reading because it does indicate how our healthcare system will run effectively 1 July of this year that's just passed. Just reminding everyone that in that legislation, the key purposes of the new health reforms is that all New Zealanders get good healthcare, but under Section 3B, we need to actively close the gap, the health disparities between non-Māori and particularly Māori, but other ethnicities, including Pacific whānau with disabilities, whānau with mental health, whānau living in a rural environment, refugees, LGBTQI community, but there's a specific requirement to close the gap between Māori and non-Māori in the Act. The Act also, in Section 5, brings in the Treaty of Waitangi principles. We've moved away from the sort of 3P principles, these 5 new principles that are in the health component. But what that means is every single organisation in health must incorporate the Treaty of Waitangi principles within their entity. So if you haven't started that journey, I would highly recommend you do that sooner than later, because otherwise you'll be non-compliant with the legislation. In terms of the actual principles, I won't go through them all, but they're in Section 6 of the legislation, and then they're just summarised on these next 2 slides. But it does put a huge onerous effort on the Minister and the ministries and the Health NZ and Māori Health Authority to embed these treaty principles. So from a Māori perspective, it's probably the most pro-treaty sort of legislation we've had in forever. And then just in terms of some of the organisations, these are not all the Māori organisations in Tāmaki, but these ones have got together to effectively write sort of their version of a health plan and their version of localities, and then work on what iwi Māori partnership boards would look like and localities would look like. Most of them are based out West Auckland. That Paiheringa group is actually all large Māori providers across Tāmaki. They work cohesively together to advocate for Māori and non-Māori as well, but have a strong lens on all things Māori. In terms of the legislation, it requires the establishment of iwi Māori partnership boards to be established. That's Section 29. The one that we're looking at establishing, there's quite a lot of complexities within Auckland. Auckland has, well, actually that's the functions, but when you look at Auckland, Auckland has 200,000 Māori across from the Brendurans to the Bombays. 85% of those Māori don't have a sort of whakapapa link to an iwi within Auckland. And it represents 25% of all Māori in New Zealand. So from an iwi Māori Partnership Board, those Māori organisations are working cohesively together to try and establish a large iwi board, which effectively will replace the DHB boards that we used to have. The reason I start on the iwi Māori Partnership Boards is because those boards are the ones that will approve all localities across Auckland. So it's quite key to understand their thinking behind locality establishment before we actually get into the establishments. And I should point out that 2 key things or 3 key things that the iwi Māori Partnership Board is wanting to do is do a treaty-based audit on health organisations to see if they constitutionally look like they're incorporating the principles of the treaty. And secondly, what are they doing at an organisational level to close the gap between Māori and non-Māori? Of course, other ethnicities are important, but there's a huge focus on that Māori health component, and health needs analysis will be a key component. Here's a sort of a high-level relationship document that they've put out in terms of what we want to do in terms of before we have conversations about localities, we really need to be quite cohesive as organisations, particularly within West Auckland. So that's just a summary of some sort of top 10. I can send these out, Linda, for distribution, but effectively they're quite what we require. All of these are legislative requirements. So we're saying that before we even have a conversation about locality, do we have this basic sort of protocols in place before we can start changing the world out west. And then once again, I'll send this out, but this is a high level work plan. In bold are the legislative requirements that the iwi Māori Partnership Boards are required to do through legislation. And then indented is the sort of strategy that the Māori boards are wanting to put out in Tāmaki in terms of what they want to focus on. Once again, I'll email this out because there's a lot of words on that page, but it's just a draft document at this stage. A key part will be, in terms of Section 15, setting up a data governance group. So we haven't set it up yet. So there's a call to action that anyone on this call that wants to be involved in establishing a data governance group for Tāmaki or particularly West Auckland, just give us a ring, because we want to make sure we've got some pretty big hitters in that space, because we don't want Wellington to determine how our data is shared and utilised in West Auckland. We want that to be West Auckland focus. So that's in the process of being set up. In fact, this is not set up at all yet, but that's an example of if those organisations came together, that's what it could look like. But that's in process. We've got iwi, urban, some Māori providers. So this is specifically on Māori data, this particular conversation. And then just to let everyone know, public health, I think Salah's actually on this call I saw. So we're looking to tank up Hāpai in the public health space. So if you didn't know Hāpai, they're a tri-party organisation with Ngāti Whātua Waiparere and the health arm of Tainui. And we're wanting that to be a much larger presence in the Māori public health space nationally in Tāmaki and in West Auckland. And I think Salah's on this call now. Just quickly, before I get into localities, we're also working with Green Cross at the moment to try and get free prescriptions delivered to all whānau. That seems to be an absolute massive issue. It's not just Green Cross we're working with the Pharmacy Guild, but those guys have all the life pharmacies and all the unichems. So they've got 300 pharmacies. So if we get it right with those guys, we can get it right for everybody. So yeah, $5 prescription fee. That's just annoying. It's just more of a headache in terms of the script. Now it's a massive barrier for our whānau. But getting into localities and PHOs, so currently the PHOs are looking at being disestablished by June 2024 and having a 1 year sort of transition period from 1 July 2023 to June 2024. And they will be replaced with localities, and localities are effectively the current 21 election boundaries that we've just had through the local council voting. Those 21 councils or subgroups are effectively
it's local boards.
Local
areas.
boards. It's the local boards.
People understand.
Yeah, the 21 local boards. So at the moment they're proposing that those are the localities within Tāmaki. So we have 21 in total, and there's 3 in West Auckland, being Henderson-Massey, Whau and Waitakere. So there needs to be some sort of transition plan that says, well, actually, before we get rid of PHOs, what should they look like? And what should localities look like? And the good thing is they haven't really done a lot of thinking in the centre about what PHOs should look like and what localities should look like. So there's a massive opportunity for us to collectively work out as a bunch of providers in West what we think is best for our communities, and then we could co-design that and then send that to Whatuora and the Māori Health Authority. So that kind of gives you a timeline, but effectively think about it as a transitional period from here until the 30th of June 2023, and in a 12-month transitional period from 1 July 2023 to 30 June 2024 to scale up localities and scale down PHOs. Now, no, you will need to have an element of PHO functionality. Now, we don't know what that looks like, and we don't know if we need to have that for 7 organisations that we currently have across Tāmaki at the moment. Also, here's the 21. This is straight off the Auckland Council. I should have gone to this slide. So this is these are the 21 localities, and then our 3 out west being Henderson-Massey, Waitakere and Whau. So this particular conversation is saying, how do we come together to work out what the priorities should be in the healthcare system? Like, I'm sure we're all biting our lip when the brother was presenting the North Shore Hospital fit out, saying, well, hang on, once again, North Shore gets more services than West Auckland. So there needs to be a logical conversation to say what services are provided and need to be provided in West Auckland based on the need of our community. So that's probably a key thing. In terms of the steps required to set up a locality, so yeah, there's 21 across Tāmaki. These are 3 that we want to focus on. And then the priority populations are listed there, and they're just straight from the legislation. So there's no surprises there. So everyone in that priority population experiences a lower health outcome than everyone else in New Zealand. And then when you link that back to the legislation, we were actively required to improve the health of those populations. So step 1 is to do a health needs analysis for all of West Auckland. So we will already have data as individual collective organisations, but what we're looking to do is consolidate that data and present that into one sort of health needs analysis for the entire West Auckland. So that's something we can all individually do and we can all collectively do. We probably know the top 20 issues already. Having 24/7 ED is probably up there. Having more general practices will be up there. Having freer services is all up there. But what does it actually look like by that mesh block? Because we know what it looks like for all of Tāmaki. We probably know what it looks like for all of the North Shore, but they never do a specific breakdown. So that's what we're looking to do. So one of the outcomes of this meeting, Linda, would be that organisations that want to participate in this sort of health needs analysis should just let us know, so we can work on that one together. That's step one. Step two is you've got to confirm the key priorities. So the Iwi Māori Partnership Board, in conjunction with Te Whatu Ora and Te Ako Whau Ora, need to get together and work out what are the priorities for West Auckland based on actual data, which should come from our community groups. Then we need to confirm, as a collective of West Auckland providers, we need to confirm what the model of care that we want to run going forward. What does the funding look like? Because it must look much different if you want to focus on improving the healthcare for us. What is the connectivity to social services, given that 80% of someone's health and well-being is a social determinant, not a health determinant. So there needs to be some sort of overlap there. And then those three organisations would provide guidance on for the locality. So there's like a locality team that we need to establish. Probably a lot of people on this call will be involved. And then that team is the one that actually builds up the business case based on the needs assessment and the funding model. And then we submit a business case to Whatu Ora that then gets approved by Te Ako Whau Ora and the Iwi Māori Partnership Boards to be funded, and that becomes the new model of care going forward. So once again, it's early days. There's not been a lot of thinking on that. So people wanting to participate in that conversation should just probably go through Tracy in the first instance is probably easier, and consolidate those. And then get those across to us to sort of formulate the sort of Avengers team for West Auckland. And then step three is obviously we need to establish these plans, and those bullet points there are directly out of the legislation. So it shows what we need to do is have our priority outcomes. What's our locality model? The plan needs to be at least three years. We'd probably want to do a 5-year plan. It needs to link to the New Zealand Health Plan that was just recently announced. And we just need to provide reportage against that plan on an ongoing basis, and that needs to be provided to Whatu Ora, Te Ako Whau Ora and the Māori Partnership Boards. And then obviously those three legislative organisations need to approve the plan. What I'm suggesting as a first play is that we might want to run this as a collective impact model. And the reason I'm suggesting that is we've done that quite a few times in the whānau ora space, and collective impact effectively means the 40 or 50 organisations we've got on this call are really, really good at what they do, but they might not be connecting whānau to other services that are required. So collective impact effectively says, let's come together as one big cohesive group, and we specialise at the stuff we specialise on, but we know the strengths of the other organisations that we can refer into. So there's 5 components of collective impact. One is, what is our common goal? And our common goal will be identified by the health needs analysis. We need to measure the outcomes. So we want to move away from counting how many diabetes checks we've done or counting how many prostate checks we've done to actually focusing on outcome and health improvement, because quite often we do a lot of stuff in health, but it doesn't actually help our people. We just immunise them, but we haven't provided health literacy around continued immunisation, for example. Then there's like a backbone functionality that does all your data processing, and then kind of keeps everyone in check. And then there's a lot of communications and resourcing. So the library content that you were talking earlier on, Tracy, that's a key part, is how do we have a shared library on a server somewhere or in the cloud where we can all access this sort of information. And then the key focus is in health for those partners. I'm just taking a snapshot out of their business plan, but it's pretty much everything in health. The secondary care services is a big piece of work. It's kind of in scope but out of scope for localities. So localities is generally primary care, mental health, community care, public health, physiopharmacy. There is a huge overlap with secondary, but it doesn't sort of overlap. It doesn't sort of counter what the secondary care strategies will be. So there will have to be a linkage. So predominantly all the healthcare services that we've got going on, and I think that's me in terms of the quick presentation. So yeah, open to questions, or we can put them in the chat, and then we can sort of get some sort of FAQ going for our crew. But the key is, how do we come together collectively to advocate for 3 localities at the same time rather than doing 3 individual localities? And how do we kind of present to Whatuora what we want, rather than someone in Wellington telling us what they want, and who haven't been in their community. And we've all seen the challenges that the ED had. I remember 12 years ago working across the road from the hospital when there used to be a sign saying hospital closed, please go to North Shore. You know, and I think at that stage we had the 5th or 6th largest population in the country if we were owned DHB, and yet we've still got to bus our elders to North Shore and our babies to Starship. So yeah, I guarantee we'll all have suggestions on how we would improve it. So the key is, how do we consolidate that, prioritise that, and then pitch that as a cohesive business case to the government and to Whatuora and Te Ako Whatuora. But yeah, I'm happy to take any questions on that, Linda.
Yeah, kia ora, Lance. I think it might be good for people to just put them in the chat bar if there's a whole flurry. I mean, there's only one at the moment, and it's exactly my thoughts, Mark. Please put them in the chat bar, and we'll get them in there. Yeah, the question, same as mine, Mark. I live in, and I think you still do, Lance, in that southwestern part of the Upper Harbour Local Board, which even with the off and on ramps on the motorway force you to live north facing, even if you don't want to. It's still zoned for Waitakere Hospital. My husband just spent time there, but had to go to North Shore for his stents. So we kind of feel like in the locality planning, missing out a whole chunk of people who live in Hobsonville Point, which is huge population. Hobsonville Point, Scott Point that's building up, Old West Harbour, Old Hobsonville, part of Trigg Road, or Luckens Road there, doesn't feature in that planning. But I mean, I certainly consider myself a West Aucklander, and I actually don't go to the North Shore unless I absolutely can't avoid it. And so, sorry, I am a bit parochial. So how do we include that part of that local board? Because what I also notice is you never get anybody elected from that part of that local board on our side. And so the advocacy isn't as good as it could be even at that level. Have you got any thoughts on that? I hate to see that missed out. I mean, it's still west at the bottom of the Greenhithe Bridge.
Yeah, that is a good point, and that does cover. You're right, that does cover me. So I'm in the Upper Harbour.
We're in the forgotten part.
Or if you're some Westies call it South North Shore. But yeah, so I think there's 2 components there. I think we need to be real strong on our 3, and then we need to participate on the ones either side. So both that one, the Greenhithe one, which actually goes to Albany, and also the Avondale one too. So I think on both sides of our boundary, we should have a rule that actually our people generally will, in general, this is the downfall of localities, is a lot of people go to a doctor or a medical intervention outside where their residential address is, either for work or just convenience. So I think we need to have a staunch 3 locality plan, and it might be 3 individual plans for the sake of the requirement, but it's one plan replicated 3 times, and then and be cohesive with the 2 either side of us. And then what we could do through or what we can do, if you're on a regional or national group, you can actually influence all 21 boards. So I've the ability to influence all 21 across Tāmaki. So what we could be saying is, whilst it's here, it actually represents all of West Auckland. So we might want to draw a map around West Auckland and say our plan actually covers that, but even though it covers it in 3 or 4, maybe even 5 different iterations, I think that's how you get around that.
Yeah, and also the other thing is half of the faux local board area is Auckland Hospital zoned, and the other half, and it's almost population based 50-50. So even with the faux local board, they're kind of looking at half their local board area is Auckland, half for Waitakere, which is really strange. And then you've got that bit of the southwestern part of the Upper Harbour local board not even looking at it, but actually those people are for zoned for Waitakere. So I think there's some really complex bits around the edges. There's a huge amount of work to be done in the next 18 months. It's massive. There's a question from Trish from Hospice West Auckland. Each locality designs its own mode of service delivery. Question? Yeah.
Yeah, that's so it will be logical to have relatively consistent locality plans across all 21, I suspect. But then when you break it down, each community is quite different. So I think there'll be elements of similarity around workforce, around data collection and data sharing. And I think there'll be daylight difference when it comes to populations and rurality and different communities within it. So I think it's sort of a hybrid model where, yeah, best breed for the entire Auckland city, and then what does West Auckland look like in terms of what services we want developed, and then what model of care, and then what funding arrangements. So there's a and sort of model, and it could be old school PHO becomes the backbone or something like that, or it could be a merger of PHOs, or it could be let's run 5 localities together, but these are the 5 individual unique components of each locality. But once again, the good thing is the centre hasn't designed any of this stuff of substance, so it gives us the ability to influence that decision significantly.
Yeah, thank you. And I think Rob Warrener's comments, very passionate about this, because like me, my spelling goes to the pack when I'm churning that out, Rob. I think that's the other issue for us, is that if the locality planning is around not so much the hospital, where's our voice anymore? Because we've got a consumer council, but they're talking about making it regional. And I think that's a lot of people's concerns, that we don't really, we worry we don't have that influence over what we have called our community hospital, and not having that consumer council anymore and making it a much bigger thing makes less likely for our local voices to be heard in that secondary and tertiary care. Have you got any comments around that?
Yeah, what I would suggest is we would set up our own locality team and I'm just thinking out loud, let's call it the West Auckland locality team. And then there's a call for whoever to participate in that team, and it must cover, because these are a significant part of the legislation, to incorporate consumer voice or whānau voice into the co-design of localities. In fact, they won't be signed off if there hasn't been done if a significant amount of work hasn't been done with communities. So we could ensure that when we set up this locality team, and it's just new because we probably only met as a few providers maybe a month and a half ago. That was our first hit out. So anyone on this call that's interested, probably through Tracy, if they're keen to be part of this locality team, and we might have a governance group and then an operations team, and then they're part of the co-design on services, models of care, how we connect with each other, the data sharing governance group. These different aspects of what we could do. There's probably some cool stuff that we've already got that we just want to keep, and there's probably a whole lot of rubbish we want to throw away and start from scratch. But yeah, there's a call for anyone, and not just on this group. Like, you'll have wider colleagues across your organisations who want to participate, and then we'll just build up this from. So the locality team is then funded by Whatuora for a transition period, which could be 6 to 12 months, and as they're funded to build up, then these are sort of rescaling, and no one knows what PHOs will look like in 30 June 2024. And no one knows what 21 localities will look like. So it gives us the ability to think now what we want, and then all of us should be included in that. So it might be there's a working group, there's a governance group, and then this becomes the sharing mechanism that, so we make sure everyone who has an active involvement in healthcare in West Auckland participates and or is part of the conversation and is at least briefed on what's going on. So by the time we put it up, hopefully we've got 100 organisations give or take, supporting the model of care and what our localities look like. Because there's about 250,000 people, right? So it's a big, it's a big number, and we have quite a dysfunctional hospital relative to what Auckland's got 2 hospitals, or 3 if you include Starship. And then North Shore's got, their after hours is quite, so after hours I suspect will be a challenge in our business case as well, as will workforce, as will be the aging general practice workforce that we've got.
Sorry, no, I was just going to say, I think that might be the best idea, that if people are interested in being part of this, put it in the chat bar, and then Tracy can collate the names, work with Lance on that. There's a couple of other questions here, and one was on my comment about consumer councils, and what we've heard from our Waitakere Health Link rep, Samuel, and then Laurel is another member who said is, we'd sort of heard, well, there might be bigger regional consumer councils. So we really don't know whether the consumer council will stay or go. They've had no confirmation as far as we know, and I think Laurel said that. So that's going to be a big issue for the community, making sure it's heard. But one of the ways that we can do that is, as you say, get involved in this locality planning from an organisational perspective, and organisations know their community. So I think that will help, but I think there is another piece of work there. And the other one, Helensville Rodney, that Trish has asked. I mean, a lot of people live west who are Kunyu Huakai, and I don't even know what they're zoned for, if it's North Shore or Waitakere, but for a lot of them, they stay on that west side, and, you know, that could be another morph that goes in there. That northwest is huge. It's going to be something like a 350,000 catchment. It's massive. And so, you know, that's a really interesting piece of work for you to do, Lance, is how, you know, do we actually need to involve, you know, because where does Helensville fit in? Where does, you know, people that actually come down to Westgate for their shopping, their healthcare, all of those things, that's going to be quite significant.
But just on 3 of those points that you just raised, firstly, I was trying to get everyone in a room, and I was aspirational to do that before the end of the year, to sort of have this as a co-design. So what I have been doing in the interim is going to organisations and having this conversation organisation by organisation. So, for example, I'm going to see the Salvation Army next week, I think it is, and presenting to their entire exec. Yeah. I can, if the consumer group on this call reached out to me, I can come and present to that consumer group just as that group, and then they could give me their advice on how we might include that in our locality planning or our locality teams. That's the first point. The second one is on the is actually 3 localities now that we share a boundary with, because it's the Kaipara boundary as well, in the Helensville boundary. So that'll actually be led by Ngāti Whātua, that piece of work, because that's sort of their place. So we're trying to get it so that treaty partners lead out as much as possible. So the Rodney Local Board, that's the Runanga or Ngāti Whātua's sort of space. So, but once again, I think we need to have a conversation with that boundary as well to make sure we're cohesive, because there'll be people that live in Helensville but do go to have their services in Henderson, and probably vice versa. So I think the key is be really, really strong on our 3, and then have a tight conversation with the 3, like the North Shore facing one, the Far North one, and the sort of Auckland City one, like Blockhouse Bay area-ish.
Yeah, Avondale.
And then kind of, so ideally we're putting in 6 business cases, but 3 that we've developed ourselves, and 3 that we're a strong component of in terms of the other boundaries for those localities.
Thank you. I think there's some questions around budgets, etc. I mean, I think that's a big for PHOs. They're going, goodness, how do we do this? So I think this is probably the next steps around, you know, put yourself in there. We will work with Lance to get back to you, and also give that contact, his contact. So it's going to be a lot of work if you're going to have to go and present to a couple of 100 organisations, but there may be a better way of doing that. So I guess the next steps are, let us know if you want to be part of this. We've got questions in here as well, which Lance will have a look at, and we'll put something together for that. So I guess in terms of next steps, that's it. It's going to be this big piece of work of lots of talking to each other, lots of planning, the needs assessments and things like that, so that we as a wider West Auckland community can develop those plans. But there's also going to be that back end work that I've seen around looking at the way organisations are structured, you know, whether they're reflecting the needs and aspirations of the Māori community, those sorts of things. So are you able to send out your PowerPoint so people can get all those details?
I can do that. And then just on the budget conversation, it's going to be tricky because the transition unit that was set up prior to 1 July, their thinking is that all this health reform will be funded within the current health budget. So what they're suggesting is whatever PHOs become and whatever localities will become, it's the same money. So I feel like that will be challenging because there's already not enough money. And if you're going to cut a little bit and you're going to need to pay out more, I think mathematically that doesn't work for us. So I think the key thing is we need to be very, very strong advocates for this is the need of our community based on actual data. And these are the services and the model of care that's required. And this is the funding required, irrespective of whatever's in a vote health budget. Because if you can't have your health needs met through a resourcing, then you're going to fail all day long. So I think we need to build it up from the community and say this is what our community needs. And because I just heard someone spend $400 million on a project, like why isn't that conversation being had with West Auckland communities? You know, so and I think we just need to be strong advocates for that individually and collectively on that sort of cohort.
Absolutely. And I mean, on council, when I was there, we had the equity conversation around things like parks and facilities, and it's a really tough conversation because the people have got more don't like anything taken away when you have to recut the pie. And so I think that is really important for us to be actually shouting out for more resources, not a bit of someone else's, because it's a really difficult conversation. But yeah, so all right, so I think we've got some good questions and people putting their hand up here. Is there anything else from you, Lance? I mean, because otherwise we could talk about this all day, I know, but we've got a kind of a time frame. But just if you're able to sort of sum up with your last sort of words would be great.
Yeah, probably some challenges we'll have. So particularly for Māori, 20% of Māori are not even enrolled in primary care. So you know, if we have a primary care only conversation, how does that work? You know, who delivers services to those whānau? And then the ones that are enrolled, 20% are not engaged. They don't show up to appointments, probably because there's access barriers, probably because there's a workforce shortage. So that'll be a challenge. And a lot of us are transient. We don't actually live. I go to a clinic who's not in my locality, so I'm not sure how that's going to work. Does my data and my funding follow me around, or is it just based on the health needs of my household, but I go somewhere else? And a key component will be the workforce challenge behaviours. Like if you weren't a good clinician on 30th of June, and all of a sudden you just work for Whatuora or the Health Authority 1 July, and you haven't changed your behaviour and haven't understood the treaty or Māori health outcomes or whakawhanaungatanga or tikanga, that's not going to improve anything for our people. You've just changed the name, and you might as well have become oranga tamariki because you haven't changed your behaviours. So cultural competencies will be a key thing for the workforce as well. So that's something that our organisations will individually and collectively need to sort of look at ourselves.
Kia ora. I want to mihi to you for, you know, this is a huge piece of mahi that is going to be going forward, but I'm really pleased that one of our local urban Māori authorities has got the task, who knows West Auckland, and that you're so willing as an organisation to reach out into our community. And so it's going to be a good change. We hope it's for the better. And I think if we put a lot of effort into it and help design it, it will be really great for us. So look forward to all of us working together. And so thank you, Lance, so much for that. And I hope that's been really helpful to everybody.
Goodbye.
Yeah, kia ora. So we've come to the end, and it's been really interesting. I hope people have got a lot out of it and enjoyed it, and thank you all for taking your time out. Is there anything else I need to add before I close? Tracy, I might have forgotten, or
no, I don't think you've done a really good job. Thank you, Lance. We'll work with Lance to send something out. We'll send the presentation and maybe the next steps of what Lance's plan might be going forward. So thanks everyone for coming. Great to see you all again.
Thank you. And did you want our executive members to stay on to talk to Lance or not?
Yeah.
Oh, okay, all right. So Kay and Samuel and Sunil and whoever else is here stay on. So I'm just going to do a karakia mutunga to close. Tūtawa mai I runga, tūtawa mai I raro, tūtawa mai I roto, tūtawa mai I waho, ki tau ai, ki Māori tū te Māori ora, ki te katoa, homie, huie, tāhikie, kia ora. And I'll just translate that. Come forth from above, below, within, and from the environment, vitality and well-being for all strengthened. And I've missed something at the end when I took a photo of that, but Lance will know, for all the world. Kia ora. Bye, everybody, and see you next time. Thank you.
Thanks so much, everybody. Bye.
Bye, Liz. Trish.
Everybody, bye.
Bye.
Be safe. Thank you, everyone. That was
Thanks, Nanette. Oh, good to see you there, Nanette.
Yep, love you.
Bye. Love you too. Bye. Oh, and sorry. So who have we got?
So Neil and Samuel had to go, but I said, yeah, that's all good. But, because we'll be talking about whatever we talk about now on Friday at our meeting, because Lance couldn't make Friday. So we're sort of going to.
Okay, so who's Kim J19? Who's that?
It's okay. I'll just remove them.
And do we need Ben anymore? He can.
Oh, he's probably run away already. Do you, you can
so
go.
We've got, who have we got? We've got Kay, Linda, and Zari.
Who's Jason Alexander?
Yeah, I'm just getting.
Do you want me to keep recording, or is my part done?
Hi, Ben.
Hello.
No, you can stop recording now, and I thank you for your help.
Yes.
Not a problem.
Much appreciated as